We are going to go ahead and get started. I wanted to welcome everyone to the webinar. For those of you who don't know me, I'm Dr. Lauren Levine. I'm your host. I'm your moderator. As always, we had just a great turnout. We had well over 500 people registered this evening. I hope, as always, that everyone is staying healthy and safe out there. Also, as always, I commend you for being here and continuing your dental education. I'm only going to speak for a couple of minutes. I want to make sure that Dr. Burton can speak for as long as he needs. He also had said that he really wants to make sure that we leave time at the end for questions. Most of you have been on the webinars in the past. You know how it works. If you haven't been on a while, you're new here. On your screen, you have a GoToWebinar control panel. You just type in your questions as you think about them. We can't do verbal questions, obviously, with 500 plus people registered. At the end, I never know how many questions we're going to have. Sometimes we have 5 and sometimes it's 75. So we'll try our best to get to as many questions as possible. I take them as I see them. Sometimes if questions are similar, I'll combine them together. But just type them out as you have the questions and we'll get to them at the end. We don't interrupt the speaker when we're doing that. In the next few days, look for a couple of things. This webinar, as with all the other webinars that we do, is being recorded. So if for some reason you can't make it to the end, you get distracted, don't worry. You will be sent a link that you can download and watch the recording in its entirety. During the webinar, Dr. Burton is going to be showing some of the products and systems that he uses, which are exclusive to Golden Dent. I want to thank Kurt and Golden Dent. We've got Jason here this evening as well for sponsoring these webinars. They are the ones that bring in these amazing speakers. They're the ones that decide on the topics, and they also handle the CE credits. It is rare that I get anything less than about a dozen emails after every webinar asking me about CE, so I will explain the process to you. Basically, you do nothing. There's no quiz, there's no exam, there's no registration. What happens is that at the end of the webinar, I send the report to Kurt at Golden Dent, and it will show when you logged in and when you logged out. As long as you were here for the bulk of the webinar, at least half, I'm not sure if there's a certain number, but they will then send out the CE. Obviously, when we have 500 plus people, it can take a while. So keep an eye on your inbox. If you don't have it within a week or so, feel free to reach out to me and I'll follow up with them, but they're pretty good about getting that out. So with that out of the way, I'm thrilled to welcome Dr. Matthew Burton. He's worked as a general practitioner in a southern suburb of Chicago for 15 years. He is passionate about dental innovation. He enjoys inventing and testing and developing products designed to enhance direct composite restorations. Over the past few years, he's become focused on utilizing forward-thinking technologies and embracing these advancements as crucial to office efficiency and case outcome. He's come to realize the importance of digital scanning and how software integration platforms are key elements to utilizing the scan data. Furthermore, he envisions 3D printing, iOS, and digital smile software as the future for dentistry. He believes it's time for offices to begin understanding what this technology is and, more importantly, how it can practically be integrated and become extremely effective on a daily basis in any office. So Matt, we are absolutely thrilled to have you here and looking forward to the presentation. So take it away.
Thank you, Lauren, and thank you everyone for joining us tonight. And from that bio, we will be focusing on mostly direct restorative tonight, as the title suggests. So again, thank you everyone for your time, and I look forward to taking you on this journey. So to get started, a little bit about myself. As Lauren said, general dentist just south of Chicago, 16 years in practice, graduated from UIC College of Dentistry in 2008. And we didn't even have a direct composite posterior restoration requirement at that time. Our boards were still amalgam. And there was a big gap in what we were doing in schools and what the demand of the patient population was requiring of us outside of school. And so I started to realize this and actually kind of maxed out a credit card that I had and started taking cosmetic courses with Bob Margis and Jason Smithson and starting to understand what composite dentistry was, and that was kind of my start. And then went through all the washing machine of, matrix systems, bonding agents, materials, curing lights, everything over the following years, after that. And so it's been a crazy ride for sure for any dentist in that era. But now we know that we've got it pretty well nailed down. Materials are great, bonding's great, and a lot of matrix systems are out there that are great. And but there are certain situations that we still run into that are a bit mind-boggling. And so that's where the engineering mindset comes in. And I enjoy inventing restorative matrix devices, which we will discuss one of them tonight. And also started to get into continuing education involvement about 4 years ago, and it's been a lot of fun. And so look forward to going with you guys tonight. So the agenda, so we're going to go over a few different things tonight. The main agenda tonight is going to focus on typical scenarios in which our traditional class 2 matrix setup is a hindrance. And so full disclosure at this point, this course is going to focus a lot on a single product, and why that single product is useful in certain situations. And we will introduce that product, Burton Bands Posterior, and we'll explore different scenarios in which this product is very useful and helpful in more of a bailout situation. And so, like I said, I'm a inventor. I enjoy finding ways to solve everyday problems, solve big problems. And I'm also a ring user, and so I use matrix systems in my office, and I believe that they are very efficient and very effective. And the device that you'll see tonight is not one of those that is a replace all system. So, it's not going to replace every single thing in your office, but it is an interesting bailout mechanism for those cases where you're kind of scratching your head at the end of the appointment, wondering, what went wrong. And so we're going to dive into those scenarios that get us to scratch our heads and start to understand and be able to identify them ahead of time, or identify them while you're doing it, and start to figure out how to solve those problems on the go. And so you're not spending a ton of time on things and wasting patients' time and your time and frustration and not getting the results you want. And we will then we'll briefly touch on a second system for the anterior, but most of tonight's presentation is going to focus on the posterior. So why did I develop this product? What's the need for it? What was the drive? And I think this is an important way to start it before we even introduce it, is I started to evaluate why some days had ups and downs. And sometimes those ups and downs would be a matter of an hour, right? I would have a great day, and then I'd walk into a class 2 situation that I was expecting to take 45 minutes or an hour, and an hour and 40 minutes later, I'm now 40 minutes behind. My hygienist is mad at me, and I didn't get a result that I wanted. And the patient's kind of, feeding off of this, like, I thought I was only going to be here for an hour, what's going on? And so I started to focus intently on what I considered a class 2 failure in those types of situations. Was the appointment too long? Was I fumbling and stressed out? Why was I surprised or caught off guard at the, quote unquote difficulty of a situation? Could I have been more prepared as the treating doctor? Did I miss something in the complexity? Did I miss treatment plan this at the hygiene visit? And ultimately, I began to realize a simple fact that not all class 2s are created equal. And I think that this is an important thing to kind of wrap your mind around as a doctor, because it took me a long time to do that, to really appreciate that not every single class 2 is going to be the same. And it doesn't always, the difficulty is not always gauged on what we think it is, which is how big is it, right? And so sometimes the big ones are fine, and the little ones are the ones that catch you off guard. And in reality, class 2s, while they're one of the most, the most time, they consume the most of our time. It's what we do the most often, right? Class 2 directs. And while they are a big chunk of our schedule, they are also the most highly variable procedures that we do. And when we think about that, I used to think that if it was small, it was probably easy. And if it was large, it was probably going to be hard. And I came to understand that, the variables that determine whether a class 2 is easy or not, they extend well beyond the size or the depth of the restoration, because sometimes some of those deep ones, I would just crank those things out, no problem. I would feel like I was on top of the world. And then other times I could not be humbled anymore by a relatively simple looking lesion. And the outside variables often have a greater impact on our perception and the reality of the complexity of the situation. And when I started to realize this, that's kind of when I started to change my approach. And changing my approach meant using different tools for different situations, and having those tools on the sideline at all times ready to go. Sometimes I would know ahead of time that I was going to use a certain situation or a certain matrix system, and other times I would open it up and look at it and say, hey, I've been here before, I know what to use. And that's one thing I want to really drive home tonight, and we'll talk more about that, is having more than one matrix system in your office is really key, because we run into a lot of different things. And I have doctors asking me questions all the time about completely different scenarios. Certain doctors are like, how do we do a back-to-back? What do we do if an entire cusp is missing? What do we do? Will this system work if 2 cusps are missing? And it's like, those are incredibly different scenarios. And so in order to solve those properly, we need to have different tools in our toolbox, or else, if you only have a hammer, then everything better look like a nail. And so understanding these different scenarios and what drives the difficulty or changes the ease of these situations is critical. And it's an easy thing to kind of start engaging with and understanding. And so access to the area is huge, huge. And I had the case today. I was about 3 o'clock this afternoon. I had a gentleman come in, and I knew he has really tight masseter muscles. He's a clincher. I've made him a couple night guards in his lifetime, and whenever I ask him if he's wearing it, he tells me he's supposed to. And so those certain cases where we have limited access, where the patient can't open very far, or the tooth is angled a certain way, it really places a lot of difficulty. And one of the main reasons is not only visibility. I used to think that it was all because, it's hard to see, and if I can't see it, I can't fix it. And the reality is that limited access makes it hard to get our instruments in there. So our traditional matrix systems all of a sudden become a little less helpful, if you will, and they become less effective, and that makes you less effective, because if your tool's less effective, then all of a sudden you've got to figure out how to get yourself out of that situation, while the tools are maybe not going to help you how they did in other situations. And so limited access is one of the biggest ones. And another one that we'll kind of touch on tonight, but it's very important, and I have other courses on importance of wedging and all of that, is what I call weird physics. And so there's certain class 2s that look like they're going to be okay to resolve. You'll prep it out, and then how many times have we put a matrix band in there, look down, everything's fine, and then we put our wedge on there, and then the matrix band completely deforms and it collapses into the cavity preparation, and then we're kind of trying to put a ring on top of that and solve the problem. But there's certain things involved with the depth of the preparation, the width of the preparation, and certain types of class 2s that get us into these, what I call weird physics. And another big one that's weird physics is tight embrasures. And I actually have a course coming up in about a month and change on focusing on tight embrasures, because it's one of those things that is it can be a real hair puller when you're trying to get yourself out of those situations, because all of a sudden nothing works that you use. You can't get your matrix band down there, you can't get your wedge in all the way, everything's bleeding because you've tried 7 times. Oh, and it's in the back of the mouth, right? And so there's those situations that we land in, where the physics of the tools that we're using are changed and altered, or they're not quite as effective. And then ultimately we run into this all the time too. I call it a cluttered workspace. And whenever we have, multiple lesions in a row, multiple big lesions, and we're trying to use 360 matrix bands or other things we can have a hard time by the time we start getting our matrix bands in and our components that we're going to be using to create our walls. It gets difficult to place wedges and rings in these situations. And so if we look here in these areas, I'm going to turn on this pointer really quick just so you can see it better. And Lauren and Jason, let me know if you guys can't see this. But when you go in here, after you get these matrix bands on, and you try to put a wedge in between here, it is mighty difficult, right? You're going to have to wedge from the palatal only, because by the time you get the patient's cheek here in this situation, it's going to be nearly impossible to fit things here. And then trying to kind of navigate rings around these can be a little tricky. And so we end up in these cluttered workspaces, and it can really alter how effective we can be in these situations. And so impeding access can really play a big role in how effective we can be. Let me just switch this off. Hold on one second. When I do the spotlight, it won't let my screen go back. All right, so on to this. So not all class 2s are created equal. So when I realized this, it created a bigger question for me, and I've kind of hinted toward this. With such a variable or variance in what we do with class 2s, how can we expect a single system to handle every single case in an effective and efficient way? And the reality is it's kind of hard to do that, right? So we need multiple tools to be able to solve different situations depending on what we run into. And that's where I came up with this idea, and I call it Burton bands posterior. And the Burton bands posterior, you can see here, and we're going to see it from a few different angles, but it's essentially it's a wedge matrix unit in one. And if you look at this from a couple different angles, there's two key components to it: the wedge, of course, and the matrix. And the wedge has a unique design that splits. So the wedge wings here are not bound at the tip. So these wings can float independently when you place them in the embrasure. And this does a key thing. It allows the side that's attached to the matrix band, which you can see here, this side right here, it allows that wing to float with the tooth around line angles and helps create good contour and good matrix seal all the way around the curving angles of the teeth, because our teeth aren't flat, right? So they're always curving, they're always changing directions. And the other thing is a very designed or contoured matrix band. So when I designed this, I wanted to put a marginal ridge in this, and so it would have it built in and ready to go. And so we would have to do as minimal amount of polishing at the end as possible. And so this is what the design of the system is: splitting wedge, matrix band, and it is a very effective device in certain situations. And this is just a couple different angles. We will drive into this. So where is it effective for? And I say it's a unique tool for unique situations. So what I was talking about earlier, not all class 2s are created equal, right? So for a majority of what I do, I'm using standard matrix and ring systems, and that's the most efficient thing for me. But when I run into these situations, and I'm going to go through a few different ones here as we go, then this is when I start to use it. And one of the cases is the unexpected class 2. For example, you get in, you're doing a class 1, you're set up for a class 1, you have however many minutes, 30, 45 minutes to do it, no problem. And then you kind of start to clean out the mesial portion of that class 1, and you realize that it is indeed a class 2. And so it's one of those great things that you can just pop it in there, because a lot of times those aren't that large of lesions, because you didn't see them on the radiograph, they didn't show up, but they were there clinically. And so it's a great little thing to pop in there and just be able to bail you out. Another area, mesial lesions on second molars or the poor access and short clinical crowns. So, these areas of poor access, and which is the second molars, they have a lot of variables that they throw at us, right? It's tough to get to. The crowns are short, so a lot of times our ring systems have trouble engaging them, and it's hard to see, and we want the fewest things possible back there to not impede our working environment. In another section, interproximal root caries below an existing restoration, and we'll go over all these. Tight embrasure scenario that I was talking about, MOD situations, mid-ortho class 2, this is an interesting one, and mesial lesions on first bicuspids. And so let's dive in and start getting through all of these. Unexpected class 2 scenario, just like I mentioned before. So this patient came in, and believe it or not, it was just a removal of an existing amalgam, and that's the darkness that you can see down here. And when I got in there, there was a small fracture line on the mesial marginal ridge, but it didn't look too damning. And radiographically, it was clear. And then when I got in here, it turned into this, and you can actually still see that the fracture went even further. And so these types of situations, they can really disrupt your schedule, right? Like you're planning on doing one thing, and now all of a sudden, it's kind of exponentially harder. And it's nice to have a go-to tool to kind of bail you out of these situations. And so this is the Burton bands posterior placed in that situation. And so you can see the wedge handle, and you can see the splitting wings on the palatal side here. So most of the time I'll insert it from the buccal direction, but it doesn't have to be that. This thing's extremely versatile, and I'll drive that point home a few different times tonight. It's like you can use it however you want, and I'll show you a few different ways to. So you can insert it palatally or facially, it doesn't matter. But you can see the wings split here, and that's the papilla right in the middle. So that wedge being able to split allows the matrix band, which is attached to that portion, to kind of follow the tooth all the way around. And then you've created this little home for your restoration. And in this case, all we do is restore. So in cases like this, where you don't have a super wide prep, you don't necessarily have to use a ring. You can if you want to, and I'll show you how to do that later as well. But in these cases where you have, a pretty tight wedge here going in, you can just burnish this matrix band and be done. And so that's what we did in this case. That's immediately after, and that is the final restoration. And I took a radiograph immediately after just to kind of see how effective this was in these, because that restoration went subgingival, as you could see there on the previous slide. And this was before I did any occlusal contouring on this, but you can see how nicely it sealed the gingival margin up in this area. And again, it's just a nice bailout tool. It's not for every single situation, not for back-to-backs, not for a ton of quadrant stuff, but when you find yourself in these situations, it can do a good job for you and help you get through that situation relatively quickly. Next scenario, the poor access, the one we've been spending some time on, and this is really the area that it's most effective, for me, is these short clinical crown scenarios and just really difficult area to reach. It's hard to get 8 things back there to solve it. And when I can get my ring and sectional matrix back there, I do, and I get it done. But sometimes you find it very difficult to do. So this is a patient. And I took this picture and I left the cheek in here and everything on purpose, because I feel like a lot of times we see these images and we don't get a true perception of how difficult the case was, right? Like the images can make it seem like we had more access than we did, and that, I had a mile to work with. This was me struggling to get, I took this picture probably like 7 different times to get one image. And so I was working in an extremely tight environment back here, and the patient's masseter muscle and cheek muscles and cheek tissue was just like collapsing in on me. And I'm not a huge rubber dam guy. And even if you were, then yeah, you wouldn't have the cheek in your way, but you still have limited opening. And so the patient also had a hard time staying open. And so I would have to go in and out in spurts. And when these cases get tight, placement of matrix systems back here gets a little tough, and we don't have much height to work with. And so that's where things get clumsy, and we need something to just kind of bail us out. And so this is a good example of me actually placing the system from the palatal. So if you look here, you can see the preparation's done, Vitribond laid down, etched everything. And I like to do all my etching before I place my matrix bands in. And the reason is I don't like to put any liquid in after I place my matrix band. So I try to keep the area completely dry. So I'll etch everything before, rinse it off, dry it off, and then place my matrix band. And so we did it from the palatal in this particular case. 2 reasons. 1, I didn't have a ton of access from the buccal. 2, I had the easiest line path of insertion from the palatal. It was like a slam dunk, and so you can use it from either direction. Place the system here, burnished and restored, and you could see the gingival margin, seal here. So it's kind of checking off all the important boxes for us, right? Gingival margin seal all the way through, matrix bands covering the buccal and lingual aspects of the box. That's all we need. We don't need a matrix band that goes all the way around the tooth. It's okay. We just need it right here, right? This is our working environment. And so placed in there, pop the restoration in, and the patient was on their way. Interproximal root caries scenario. So this one I'm going to show you from start to finish. You're going to see the beginning and end. These are tricky, and they'll never be easier. And patient came in for routine bite wings, and you can see number 4 has one, and number 30 does as well. But we're going to focus on the number 4. And so when we get into these cases, like I was saying, the weird physics, right? So we get into these root caries, and why are root caries so hard? You know, and part of the reason is they're hard to restore, right? So a lot of times our tools start to act a little bit outside of what we're expecting them to behave like. And when that starts to happen, then things get real really fast. And so finding something that can just kind of bail us out of this is key, and wedging these is the big issue, to be honest. And so let's show the preparation. And we're familiar with this. And again, I take pictures with the raw, right? So this is what it looks like. I'm not going to clean all this up. I'm not going to put hemostatic agent here and pretend like, you know, that we're magical in our hemostasis and everything. It's like, we open this thing up, this is what we see, right? We got bleeding, we got subgingival, we've got a kind of a weird shape, and that extended a bit to the palatal here. So this can be a bit of a tricky situation, and matrix insertion can be tricky here, wedge insertion, you know, which way you're going to go. And ultimately the big one is at the bottom here, you know, hemostasis and quick control. And we need to be able to isolate this quickly. We need to be able to do it in one shot, and to be able to get in, get done when we need to get done, and get out. So this is the posterior matrix system inserted. And now when I inserted it, you can see that, you know, you can see the marginal ridge built in here. This is a pretty good shot of this. And when I inserted it, I noticed that my contact area was kind of open because the molar was heading in a bit of a different direction. So my matrix system had to follow the contour of the tooth, right? The preparation, which was essentially on root surface at this point. And my matrix band, despite trying to reach all the way over there, didn't quite make it to a super closed or as broad of a contact that I would like from the mesio or the buccal lingual dimension. And so what I did was placed a ring on it. And this is the Wago matrix ring. And it is I think it is autoclavable, and Jason will touch on that later. I'll let him answer that question. And I think you can get a few uses out of it, but it's a V, you know, it's kind of like a V ring, very similar to Triodent Paleodent. And so you can see that all I did was when I placed the ring on, I engaged the wing of the wedge that was attached to the matrix band. And you can see the other wing here is just somewhere in the middle. It's just hanging out under the V. The other side went over the handle. And so when I placed this ring, now you can see that my matrix band was able to be approximated to the neighboring tooth. And that allowed me to make sure that I got a proper contact. So again, I'll go back to this slide so you can see here, I appreciate that the matrix band was being pulled away from the tooth due to the shape of the preparation and the fact that it extended palatally. So I placed the ring on top just over this wing, and that allowed the matrix band to touch the neighboring tooth. And this is immediately after that visit. And so you can see that we have our contoured restoration here. It follows the original form of the tooth. Didn't have to deal with any overhangs in this area. And again, just one of those situations that can kind of drive us crazy, and unique tools for unique situations. And the radiograph at the end, you can see here, real nice seal here at the gingival margin. and nice contour. And you can see how it kind of mimics the mesial contour of that tooth as well. And once the papilla and everything kind of heals in there, it won't be quite as big of a triangle. But when you have patients with periodontal, you know, issues, and you have these shapes coming from these directions, you're going to get triangles. And so just trying to get a real nice proximal contact here and really good gingival marginal seal, and encourage excellent, you know, oral hygiene to help keep those margins clean. Tight embrasure scenario, and that was the one that I was just in earlier this afternoon. And these can be a real bear. It's probably, I think this is probably the hardest thing of the class 2 situations. And the reason it is, and I wrote here, tight embrasures can be ridiculous to restore. They can really make you feel like you're trying to work with your feet in the mouth. And the reason that they are is, I think, largely because they occur mostly between the first and second molars, which is already a hard area to work in, right? So it's kind of unfair. It's like, why does it have to be even harder back here? You know, I can barely get my stuff back here to work. It's hard for me to see. I'm tired. It's the end of the day. And now you have to throw these tight embrasures at me, and they can just really, really mess up your day. And one of the reasons that they're really difficult is that even if you prep them and you prep them well, there's just like the embrasure and the tightness in the embrasure and the contact area is just like a mile wide, you know. And so you're trying to put your matrix band in, and it's denting and it's getting hung up on the margins down here. And what I've ultimately realized is that in these super tight embrasure cases, like in certain situations, it might be better to insert the matrix laterally and allow the matrix band to kind of like creep in here from the side instead of trying to do it from the top down. And that will allow a little bit of an easier insertion path and allow us to resolve the situation. And so in this case, this is what I did. And so I'll show what we did to modify this wedge, and I'll show it in detail later, but you may notice that there's only one wing on this wedge right now. And so when I get into these super tight embrasures, let me show this area again. When I get into these tight embrasures, the size of our wedge is going to matter, right? Because if you look at the space here and it's full of papilla, we can't put a traditional wedge into these areas. It's very difficult to do because there's not that much space. And sometimes you can identify these tight embrasures on x-rays and kind of be, you know, preempted to be ready for it. And other times it looks like it's not tight, and then you get in there and it is tight. And so trying to fit the full wedge here may be overly difficult. So what I do is I snip off one of the wings, the wing that's not attached to the matrix band, and that gives me a nice skinny wedge wing here just to be able to glide into position there. And again, you can see we got gingival margin seal in this area. We've got our matrix band just covering our buccal and palatal portions of the preparation, and that's all you need. You don't need the matrix band to go, you know, all the way over here. It doesn't have to do that. And if it did, it would make it really hard to put this in. And so this little guy squeaks right in there. Again, the lateral insertion. And in these cases, the matrix and the wedge are so snug in there. This thing is like tight in there that if you get that kind of snug insertion and settling of everything, then I typically do not use a ring. You can see my matrix band was approximated nicely on the tooth there. And that's immediately after the restoration, and that's immediately after polishing. And doesn't take long to do those when you get into those situations, and it's a quick way to kind of bail you out of those tight embrasures. And the MOD scenario, MODs can be tricky too. I'd say they're the second trickiest. When you get on bicuspids, we have a lot of hardware in a small area, right? Especially if we're trying to do it in one swing. We've got 2 matrix bands, we've got 2 wedges, we've got 2 rings. And if you try to do it with the 360 Toffelmeier style matrices, that can also be difficult because then you got the arm coming off of that thing, which will hinder the mesial placement of the wedge in the ring. And so essentially what happens is we can run out of working space very quickly in these situations. And additionally, when we start to run out of working space, our tools may start to interfere with each other. And one thing that I was noticing a lot on MODs, and this is not for every situation, but bicuspids, and keep an eye on that, even if, you know, you want to take something from this webinar tonight, if you're wondering why MODs, you end up with big flash chunks here on the buccal or the palatal line angles, a lot of times it's because your matrix bands are interfering with each other in these areas because they have nowhere to go. And so you can trim these down to make it a little bit easier, but a different way to do it is to pop these things in. And then now I've got less matrix band and less setup and ready to go, and place the ring on this guy here. You can see here how it split it, and I used the Wago or the Wago ring here and popped that in there, filled everything, and our final situation in this situation. So MODs are pretty slick, and so it keeps a lot of the stuff out of your way and allows you to have a much cleaner working field in these certain scenarios. And again, do I use it for every MOD? No, I don't. But this was, if this looks familiar, this was that super poor access case. So I ended up restoring multiples on her, and this took some time because I had to do individual restorations as we went, but it was really the only way I could get back there. In her case, is I had to break it up over time. And so I was prepared for that. And in this case, we deemed it necessary to use something that allowed us to get a minimal access, and MOD situation here, and the posterior matrix handled it quite well. Mid-ortho class 2s, we see this often. Patients come in and they've got caries interproximally, and when they have wires on in brackets, it can be a little tricky to restore, and it can also be tricky to organize because a lot of times we don't want to be snipping those wires and causing orthodontist more work, or maybe the patient's not going to follow up with the orthodontist. So it's like, do we call the orthodontist? And a lot of times kids have limited schedules during the school year because they're playing 3 sports and they're doing all this, and so scheduling becomes difficult. So this is one of those cases that it's a bailout where you end up with one of these class 2s and then simply just insert it from the lingual or palatal, and the wings will float underneath of the bar, and you can just pop this matrix system in there and do your thing and restore this class 2 with ease right around those wires and brackets. And finally, the mesial lesion on the first maxillary bicuspid, third most difficult area to work. And this little area is so tricky. It's almost as unfair as the tight embrasures between the first and second molars. And main reasons include, one, we're transitioning between an anterior tooth and a posterior tooth, right, in one little slice here. So anterior matrix systems or anterior techniques work on this tooth, posterior situations work on this tooth, but when you butt the two up, it gets tricky, right? Ring placement can be a little dicey, and on top of that, we always have a cute little concavity or at some level on the mesial of this root. And so it's kind of one of those situations that we look at and we're like, oh gosh, we always know, we're always warned about this area. And so it's one of those that's, again, a bailout situation or a bailout tool is very effective to kind of overcome those challenges. And again, I told you I like to etch the tooth all the way. So I'll etch just like this, keep the patient open and let it sit for 30 seconds, rinse everything off, dry it, and now I have a dry field to place my matrix band. So if you look carefully here, you'll see that the matrix band is actually sealing the entire floor of that gingival margin there, which even took that little concavity shape. And that's a great thing. It's a great easy tool to be able to pop in there and kind of solve that situation on an isolated lesion. And it also gets us past the fact that we're in between, we're in between types of restorations, and we got an anterior here and a posterior here, and that's where our systems they can struggle. Now, if I have room on the canine or contour on the canine to put a ring, I will. But sometimes we need these scenarios where the canine has a real steep lingual incline and nothing wants to grip it, and it's hard to get a matrix band in there and a wedge and just hope. And so this gives you a little bit more control over those certain scenarios where you can effectively handle these situations. And in this situation as well, you can see that the embrasure was a bit tight on this, and so I'll show you how I trim these wings. So this is the standard matrix wedge setup right here. Very simply, take a pair of scissors and cut the wing off. And you don't have to cut the wing off, you don't have to cut it all the way by the handle because it doesn't even split that far, but just cut the initial half off, and that allows this leading tip to get into that area, and you're still keeping like the body of the wedge itself. And so you're still going to be getting separation because the tip of the wedges aren't doing any separating. It's all here in the body, near the near the handle surface of any wedge for that matter. And so that's the remaining tip right there. And then this is the modified wedge, and that's placed in there. That's immediately after restoration. So again, you can see only one wing here, and that's final after polish and a little bit of finishing. And so big thing I want to touch on here, those are all the scenarios you can get in, but having something that's adaptable is very key. And the two things that we went over tonight were adjusting the size of the wedge and ring compatibility. So easy to adapt this thing. Any case, if this whole thing goes in and it doesn't give you too much resistance or fuss, that's fine. You may swing and miss the first few times that you try this, but you'll learn quickly on looking at the embrasure size and what will fit and what won't. So don't be afraid to modify it, especially when you start using it. And second, having something that's ring adaptable is pretty nice too, because in that situation that I showed you where the matrix band was not approximating to the neighboring tooth, since the matrix was following the root surface of the preparation, having a ring that can get on there and give us contact area and contour to achieve a nice contact is also very key. So just nice things to have there. Really quickly, we're going to go over some insertion and removal because this is important. So any new system, there's some tricks to learn to have good success and fast success. First thing here is learning when to utilize these, and it's not a replacement matrix. I will say that again, it's not a replacement matrix. It's not like I'm only going to use this in my office. No, I use this a few times a week, maybe. Sometimes I don't, but it bails me out when I have to, when I really need it. And so it's always on the sideline, it's ready to go. And it's not something that I'm replacing my entire ring setup with or traditional system with. And so let's demonstrate how we insert it and remove it and what to expect, because it's also important when you're using new things to understand what to expect. And so here's a video demonstration. I'm going to hope that it plays. So we've got an MOD up here. I'm just going to play it. And so we're just going to kind of show here that for the MOD, we have two different matrix bands. So there is a left hand and a right hand for this, based on which direction you're going. So the matrix band or the wedge system can always be placed from the buckle. So there's a left-handed version and a right-handed version. And so we'll place it. And when I go to place it, you'll see that I'll wiggle my fingers up and down. So I'll put the wedge handle in the hemostat or the cotton pliers, and I'll just kind of jiggle in an occlusal gingival motion. And that helps that leading wing system or wing pair get around the edges of the cavity preparation, and helps the matrix band find its way around. So same thing here, just jiggle it and it'll pop right into place. And once I put it there, I'll hold it for like 2 seconds, just push it in and hold it and just press, and that helps the wedge just kind of engage and seat itself. And after you get everything into place, you're free to either place your ring on top of that and restore, or restore it as is, depending on how much resistance you met with the wedge insertion. And this is compatible with any ring, really, because you're only grabbing one of the wedge wings. So if whatever ring you have in your office will be compatible with this. And then once the restoration is done, this kind of can be tricky, and especially at the beginning, because this matrix band is pretty small, and if you're using a ring, then the contact is going to be tight. And so I'm going to give you a few tips and tricks on how to get it out. And so one thing to be aware of is that when you remove it, if the contact is really tight in between these teeth, you may notice that the wedge will separate from the matrix band, and that's okay. It means you have a nice tight contact, so don't panic if that happens. What I do to prevent that is before I start to pull the wedge out, I'll take an Explorer down here around the edges of the wedge where the wedge and the matrix band connect, and I'll run my Explorer along that edge and kind of bust that little bond layer free to just kind of start to free this up. In the same way that I inserted it, kind of jiggle it up and down in from a chewing surface to the gingival portion of the tooth, that direction, and kind of wiggle it out and pull it out slowly. But in the tight cases, you may pop it out and the matrix band's left behind, and all you have to do is just grab a pair of cotton pliers, and there's a tab on top of this matrix band, so you can grab a cotton pliers or hemostat and just grab that matrix tab and jiggle it out and just take it out how you would any other matrix band. So just something to be aware of in those tight areas, especially when I had that case where I put the ring on that root caries. I had a real tight, broad contact area. And so I'm never upset when my matrix band gives me difficulty coming out, because it means that I have a nice tight contact, so everything's okay. So tonight, leaving or closing remarks, appreciate that not all class 2 situations are the same, and acknowledge these awkward situations and challenges, and be on the offense instead of playing defense. Be ready for them, or be ready to tackle them when they show up. And another thing, big key, is break contacts. So when you're prepping, even the small ones, get small flame tip diamonds and break the contacts, and that's going to allow any matrix band insertion to be so much easier. And so if you're having trouble getting your matrix bands in no matter any case, then really try to focus on breaking contacts. And it doesn't mean that you have to blow out the restoration or make it massive, right? It's not that. It doesn't mean that at all. You just need to create space for your tools to get in there to do their job. And so one take-home point tonight would be, always break your contacts, and then arm yourself with at least 3 different styles of matrix products. Definitely have a good ring system in the queue, because that's going to be your workhorse. But also consider having like a contoured 360 matrix for cuspal involvements and things like that, things that the sectional matrix bands, they just can't reach. And then have something that's just kind of like a go-to Swiss Army knife tool that can bail you out of some of these situations where you have poor access or tight embrasures or the anterior posterior scenarios, or even a few MODs that make sense to use it in. So that's it for the posterior. And so the anterior, we will only spend a couple minutes on. It's super cool, but it's for basic class 3 solutions, okay? And basically what it is it's a solid wedge with a matrix band on its side. And so many of us may already use the beans or the posterior matrix bands and trim them and set them on their side to restore interproximally for anterior teeth. And this system is great for routine class 3s. It's not wonderful for large class 4s or anything like that, but it's really nice for a routine class 3. And so if you're using a Mylar strip and that's your go-to, then this is kind of a nice thing, because you can just pop this system in there and your hands free. You don't have to hold anything, you don't have to maneuver anything, you don't have to play with a Mylar strip. And so it's a nifty little device. But again, for the traditional class 3, not for class 4s, not for diastema closures, nothing like that, just the bread and butter class 3s. And this is just kind of showing the system on the Dentec model. So this is the device, and this is the device in place. And so you have your wedge, you got the matrix band, you've got your class 3, and again, hands free. So now I can go in here and sculpt this and place the restoration without having to touch the Mylar strip or hold things. So I'm allowed to, I can hold a mirror here and watch everything that I'm doing, and I have my hands free. And that's just a different angle. It kind of shows you how those systems, or how that system inserts, and it's a nifty little device. So with that, we will take questions, and I'll pass it to the lovely Jason Phillips to wrap us up on the evening.
So a couple of things before I turn it over to Jason. This is Lauren. Number one, for those of you who may have gotten on a few minutes late, I had told everyone, and I'll remind everyone, that the webinar has been recorded. So if you missed any of it, we will be sending out a link to that, usually within a couple of days. As far as CE is required, you have to have been here for the bulk of the webinar. And if you're listening to this as a recording, unfortunately, we have no way of tracking that. So it's only available for live attendees. But that part normally takes up to a week. There's nothing you need to do. There's no registration or quiz or anything like that. I send the report to Golden Dent. They will take a look at it, and as long as you've been here for the bulk of the webinar, they will send out the CE form. So as I mentioned, we're thrilled that we have sponsors for these webinars. Golden Dent has been a long-time sponsor. We have Jason Phillips from there. Jason, do you want me to try to put it on your screen, or just do the one that's on the that Matt has on his?
Well, did you want to do questions first, or do you want me to go through this before you do?
No,
questions?
go ahead and do the offer, and then we do the Q&A at the very end. So you tell me. Do you want me to try to put it on your screen, or?
I'll just go ahead and work it the way we have right now, and I'll just ask Dr. Burton.
Okay, that's fine.
That's fine. So here we are. I'm Jason Phillips with Golden Dent. I appreciate being here today. It's a great company, wonderful sponsoring Dr. Matt Burton today and his wonderful product, and having Dr. Lauren Levine moderate everything and handle the entire thing for us. It's a nice change of pace from what I'm used to. So here we are. We're actually closer to 89 years of Detroit dental, where a doctor named Golden has been doing a lot of work and in dentistry, and here we are today. And it's very interesting to me to be here for a whole bunch of different reasons I can't go into because we're short of time. So next slide, please. So here we go. Save 20% site-wide with our code Matrix20 on our website. It does exclude any of the 5+1 deals that we have right now on Osteogen plugs or other promo items, but anything site-wide for the next 24 hours, you can go ahead and purchase if you'd like with the code of Matrix20. Next slide, please. And if you have any questions, we're here to help. 586-585-1210 over the phone. We do have chat on our website, and you can always just go to golden-dent.com to look at anything that you want from our wide range of products. That's our webinar promo, 24-hour deal. It expires in 24 hours tomorrow, October 23rd. Next slide. And so, again, we're here talking about Dr. Matt Burton's invention, his Burton bands. If you are interested in trying that, we just broke this out here for you real quick. Your intro kit, normal price is $159. With the 20% webinar discount tonight, you get that for $127. So if you want more information, want to watch some videos or anything like that, just go to golden-dent.com for more info. Next slide, please. And so what's new at Golden Dent? So we've got a few things going on here. The big one is, you saw the Wagotrix green ring that Dr. Burton was using in his slides. The original ring that was launched was actually a single-use ring. It's this purple ring right here, and it's very interesting. It's got great retention, great separation force. The tip design I'll get into in a little bit, but it's almost identical to the original TrioDent V3 / Paladent Plus design. And on top of that, we've got this other product I'm going to talk about for a second here, the Rondium Quick Connect. It's a retainerless Toffelmeyer system, much like the Dentsply Automatrix and the Kerr Supermat system you might be familiar with. And we're also carrying the LogiBlock bite blocks from Dr. John Garrison, one of the most popular bite blocks on the market, and we're doing pretty well with them. People are very excited. It is considered to be one of the best bite blocks on the market. Next slide, please. And so here we go. There's a lot of text here, but I'll get to the point. Retainerless Toffelmeyer, you compare it to Automatrix and Supermat. If you're having any problem trying to get Automatrix product at this point in time, we've got it plenty, and we've got it ready to ship. It was actually designed by a dentist named Dr. Simon McDonald from New Zealand. He created or invented the TrioDent V3 / Paladent Plus matrix systems, and his company was called TrioDent, that he later sold, I think it was 2014, to Dentsply, and he's living his best life in New Zealand. And we're happy to be partnering with Dr. McDonald and his company right now with this. So if you have occasion to need a retainerless Stoffmeyer, you can't go wrong with this one, especially at around on average 20% or greater less cost than Automatrix or Supermat. And it's got some other features that are pretty interesting as well, as far as the sterilization compliant tensioner. It has bands that have little tabs that you can pull to each side to make your contact instead of using a little contact former or anything like that. And number one, you don't have a retainer hanging out of the mouth, so it's actually quite efficient and interesting. Nicely contoured bands, and with a 20% discount, regular price $169. You can try it out for $132, so you can't go wrong. Next slide, please. And on top of that, we've got our webinar series. The next one is going to be on December 10th. We just confirmed that maybe a couple of hours before this event. Dr. Simon McDonald will be here to join us for a webinar going over his smart retainerless Stoffmeyer for difficult direct restorative cases. And there's another product that he's going to be talking about also, which is a deep margin elevation wedge system. This is a new, not necessarily new, but sort of new thing that's got a lot of talking about right now as far as deep margin. And you can't do much as far as scanning a tooth if you've got decay that's subgingival or prep subgingival. So you see a lot of raising that tooth up, and it's something I'm familiar with from a previous life. And we've got a new solution for it that we'll be covering during that as well. The big thing right now is that we are bringing these single-use matrix rings back, and they are available now for purchase. If you look at it, 45 cents a use, you buy a pack of them, 100 rings for $45. It eliminates all the soft costs that you have from instrument processing. And also, if you've ever had an assistant throw away a ring, that's a bummer. So on top of that, you've got your ideal tip geometry. Like I said before, it's pretty much the same tip geometry as Triodent V3 and Paladin Plus. Wonderful retention and separation. And with this discount for today, you can try them out for $36 for a pack of 100 rings, or 36 cents a piece for use. It's a good deal. So next slide, please. And just again to reiterate, 20% off site-wide for everybody attending tonight. Code is Matrix20. That's good for 24 hours, and it does exclude any existing buy-get deals that we have on the website. And back over to you, Lauren. Thank you very much.
Thank you, Jason. Matt, we do have a few questions. You ready?
Oh, let's do it.
Okay, I think one of the cases you showed a case with some root caries. Do you use laser for root caries restorations?
Yeah, that's a great question. I do. I actually have a diode laser in my office. I try to manage the situation as much as I can with wedge and matrix bands. And if I can't do that and I cannot get isolation, then I will indeed laser the tissue. Also, other cases include like deep class 5s, any areas like that where I know that I'm going to be way below the tissue, and I know that, because we're not using matrix bands there, so the tissue sometimes will kind of like cave in on our composite. So I'll bust the laser out right away. But in most cases, I'll try to control it with the matrix and wedge. But it's a good thing to have in the background.
Okay. The Burton bands, are they single use or are they reusable?
They are single use. Good question.
Okay. Do you guys offer, like, if someone wants to get a demo of can you send out one or two, or is it more just they buy through the distributor, like they'll buy through Golden Dent and they'll take it on a case by case basis?
We're gonna have. Wait, what was the question, Lauren?
The question was, what do you guys ever send out samples if someone just wanted to try one or two or something like that? Is that an option, or typically is that up to Golden Dent to make that decision?
I think that's up to Golden Dent.
Okay, that's what I thought.
I'll pump
can you place the rubber dam with this matrix and wedge, or are you gonna have limited space to do that?
No, you absolutely can. You can wedge. It's just gonna wedge and sit just like just like any other system. So you can place it right on top of rubber dam.
Okay. We had a comment from someone actually that used the system last week and thought it was brilliant, and they're saying, like, why wouldn't you use these on a regular, more often basis. I mean, I assume that's the goal. Use it on all the cases, right?
It is, but it's one about, it's about being efficient, and in some individuals, you may run into a slew of cases where they're great, but like I said, I use rings a lot, and this is one of those things that I just use for, it's more for just like one of those unique awkward situations, which I run into often enough to, develop a product. So
Okay. Are there any types of cases that you wouldn't be able to use the system?
back to back. That's tough. It's too inefficient. So like when you're doing back-to-back restorations.
Any thoughts about adding pediatric sizes?
Oh, the pediatric question. Not at the moment.
Okay. We have two questions about it actually. So yeah, obviously it's one you've heard before because we
know,
got doubles.
It's tough. It's tough. Hang in there, pediatric dentist. Hang in there.
Yeah, you can be like me. You can do perio, and then you don't need to have to do any kids. How do you prevent the gingiva from getting in between the matrix and the tooth for deep preps?
That's a good question. So in those cases, when you place, if you're using any system, when you place it, what I do is I'll place the matrix band, and then I will place my wedge. And then what I'll do is I'll take a micro brush that doesn't have any bonding agent on it at all, and I'll scrub the prep dry. And if for some reason there's like a lot of tissue down there, then I have to get a little more involved, then I'll pack a piece of cord along my margin and then place the matrix band on top and slide the matrix or the wedge in. If you have a laser, you could laser it off too before you place your matrix and wedge.
Sure. Okay. Is the matrix contoured?
It is.
Okay. I think we just got through all the questions. Wow. Well, we're right at the top of the hour too. Perfect. I'll let you give some closing comments, and then I'll wrap it up for the evening.
Jason, did you have anything to add?
No, only that I'm very appreciative of all your efforts in supporting Golden Dent and in our relationship, and I always enjoy listening to you speak.
Oh, thanks, Jason. I appreciate it. And I appreciate Golden Dent hosting this evening and being a wonderful partner. And I thank you all for being here. Lauren, thank you so much for just hosting a perfect webinar, and it was seamless. No one has to know what happened 15 minutes before this. And everyone have a great evening, and we'll see you next time.
Thank you, Matt. Yeah, Matt and I had a chance to talk beforehand, and we were working out a few kinks, and it turns out that he lived about 3 minutes from where I live right now. So small world. But I wanted to thank you, Matt, obviously, for joining us and showing us the system. This is excellent. We had great attendance tonight, a lot of interest as well. I want to thank Golden Dent for not only sponsoring tonight's webinar, but I've worked with Kurt and Jason for close to 10 years. So they always bring in great speakers, always good content. They're an excellent company to work with. They say what they mean, they mean what they say. So when he tells you the special is good until tomorrow, that means it's good until tomorrow. But that 20% is probably I think the largest discount I've ever seen them offer on a webinar. So I would highly encourage you to take advantage of that. Try it out with the Burton bands or any of the other specials that Golden Dent has got going on right now. As Jason had mentioned, we do these webinars on a regular basis. We have one scheduled for December the 10th. All of you who are here this evening will be sent an invitation for that one as well. Final reminder, the webinar has been recorded. That recording will go out sometime in the next couple of days. As far as CE is concerned, that will take the better part of a week. Please feel free to reach out to me if you don't have it. Check your spam folders in a week or so. But that typically will go out. And again, there's nothing you need to do. As long as you're here for most of the webinar, Golden Dent will make sure that you get that CE form sent out in the next few days. We thank all of you. We know that your time is valuable. We get great turnout for these webinars. So obviously people are coming and learning something. And we're looking at a lot of great content for next year as well with Golden Dent. So please stay safe and healthy out there. And we look forward to seeing you all on our next webinar. Good night, everyone.